So if I can first of all call upon Tim Smart, Chief Executive of King's College Hospital NHS Foundation Trust, to get the ball rolling. Tim.
That was almost a round of applause. I hope it's a round of applause for Earl Howe. Thank you, Freddie. It's a pleasure to be here and to be able to talk about some of the things that we're doing at King's College Hospital as an exemplar of or an example of what the National Health Service can offer in partnership to support the life sciences sector in this country and around the world. And I'd like to say thank you from the start for the support given by Lord Darcy in his many roles, but particularly in his role as a business ambassador for this country, and for the support given by the Department of Health and BIS in creating UK healthcare, which I think is a great innovation and will help in both parts of the equation us do more business internationally. What has been a pleasant surprise joining the National Health Service is quite how much willingness and ambition you heard from David Nicholson earlier on there is to partner to export and develop some of the capabilities that are principally focused on healthcare in this country, and I've been very pleasantly surprised by that. Not least because at King's College Hospital, where I have the privilege of being the chief executive, is a very busy general hospital in South London. We like to think of ourselves as being unique because we are a very large general hospital, but we also have a significant number of international peaks of clinical excellence and academic excellence, which perhaps differentiates us. But what makes us particularly interesting, I think, is the fact that we have a long culture of innovation, and we have we're extremely fortunate in the diversity of the population that we serve. We coined the phrase, as we created the Academic Health Science Centre that we're part of, we coined the phrase the world on our doorstep. We provide translation capability for patients in 143 languages at King's College Hospital, and that's just an example of quite how diverse the population is, and that gives us a great opportunity to partner around the world. It also gives us a great opportunity to leverage the material that we see in the hospital and develop therapies and systems which are relevant to many parts of the world, which is how we arrived at the interesting phrase, the world on our doorstep. And we have been very active commercially in a partnership sense for a long time before I arrived 4 years ago. We've created this structure, and I think it's important to create a structure like this if you're going to be innovative, and if you're going to explore partnerships around the world, because of course our principal goal in life is our National Health Service obligations to our patients here in England, and we need to protect the hospital from the liabilities that we might incur in any activity that we undertake. So we created this commercial structure. So you see the hospital is the sort of head co there. You'll see that we're in King's Health Partners along with King's College London, South London and Maudsley, and Guy's and St Thomas's, and we're really privileged to be in that group. It's one of 5 in the country. I think we've mentioned those things a couple of times earlier during the day. They will be important parts of the academic health science networks that I know David Nicholson talked about, which will be about the diffusion of innovation and invention through the health system. So we created this structure. KCH Commercial Services Company is, if you like, the holding company of our SPVs, and then we have, at the minute, we have 4 of them, and the one there that's called KCH Management Limited, that is that's the traditional stuff. That's our private patients activity. Then we have a small company which is about performance management. We have some performance management software and capabilities, consulting capabilities, which we use across the NHS and with a number of international clients. Then we have perhaps the most interesting of these components, which is a joint venture with Guy's and St Thomas's and with Serco, which is the pathology joint venture known as GSTS, which has been in existence for about 4 years. We've been a full partner for about 2 years, and we have great ambition for pathology as we implement the recommendations of the Carter report of about five years ago. And then we have KCH International, and I just want to talk a little bit about KCH International. So this is an opportunity for us to develop small startups and understand potential and work with a number of partners with the ambition of developing them into activities of greater substance. And through there, at the minute, we have a number of opportunities. We've decided to concentrate for now on the Middle East, and I don't know whether that's because I lived in the Middle East for 5 years, or because we have a lot of patients come to us from the Middle East. We certainly have very strong links with Saudi Arabia, Abu Dhabi, Qatar, Egypt, and most recently Libya, who've asked us to undertake all of their bone marrow transplants, which is one of our areas of expertise. So just finally from me before I hand over, this is grandiosely termed a case study. Now, it's very easy to get into relationships whereby one is building gleaming hospitals and think that you're creating a legacy. What we're really interested in doing at King's College Hospital is helping particularly developing nations develop sustainable healthcare systems. And I'm really delighted that in the Kingdom of Saudi Arabia, they've started working with us through King Fahd Medical City on a nurse training program, because I think we all understand, don't we, that the long-term sustainability of the quality of a healthcare system is deeply built on nurse capability. So we've started doing this in Saudi Arabia. It's starting small. We started with the English language training. We'll move on to a degree program which will be undertaken here with clinical placements around. As the program gets bigger, it'll be the clinical placements will obviously need to be around the National Health Service. We won't have the capacity to host the numbers that may come through this program as it expands. And as it says here, there's a second hospital ready to sign up when we're able to demonstrate our success. So we're really excited by this. This is just one of the examples that that I could be talking about this morning. As it says, the final thing is we're developing other programs as well, particularly hematology in Saudi Arabia. There's again, back to my word on the doorstep point, there's real transferability of our expertise in haematology into Saudi Arabia. So I think that's what I wanted to say. I'll just close by repeating the fact that I'm very excited by what I see developing in partnership between the two departments of state that have created Healthcare UK, and I'm looking forward to helping make that a reality and make it a success. So I'm going to hand over now to Steve Johnson from the Department of Health. Thank you.